Now it's time for our sponsor perspective. I'd like to welcome to the stage Dr. Erin Kwan, Director of Nutrition Research for Gerber, the Infant Nutrition Division of Nestle. Welcome, Dr. Kwan.
All right, thank you, and good morning, everyone. Thank you all for joining us today. As a registered dietitian and a nutrition scientist, I've been really excited and looking forward to today and the chance to talk to you not only about some of our commitments on nutrition as it pertains to early child nutrition, but also have the chance to hear from many esteemed experts, as we've had the chance to do today. But as I stand here and I feel the collective passion in this room on this topic, I quickly realized that excitement was an understatement. There is a lot of dedication, a lot of hard-working organizations represented in this room, and I think it's nothing short of exhilarating. So what I'd like to start is just by telling you a little bit about who we are at Nestle here in the US. So we have 50,000 employees working across 47 different states, and we're proud recently to call Arlington, Virginia, just down the street, our new headquarters here in the US. But what you may not know is the fact that we have 97% of households in the US that are purchasing products from Nestle. So why do I tell you all of this? Well, it's because it really boils down to one point, and that's impact. The ability for us to have a positive impact on the diets of Americans. And we've actually made a lot of bold nutrition commitments in this space. A few of them are exemplified here, but one I want to talk a minute about is our commitment to early child nutrition. In fact, our ambition is that we'll have the opportunity to positively impact the lives of 50 million children by 2030. And that's a part of our United for Healthier Kids initiative, which is global, and we're proud to be supporting here in the US as well. And one key piece of this initiative is really helping to advance the knowledge and to help provide information to help advance the science, as has been discussed earlier this morning, when it comes to fostering a healthier generation of children. And at Gerber, we want to do that one baby at a time, not only through our products, but through education and service as well. But why? And I think it's a bit of preaching to the choir to be talking to a room of so many experts, but there's really no way to soften it. Our children's health in this country is at risk. In the past 30 years, child obesity has more than tripled, with now 1 in 3 children being overweight or obese. And what's even more sad is when we specifically look at children, young children between the age of 2 and 5, we now see 14% of those children already obese. So this puts them at increased risk of many health conditions such as heart disease, diabetes, and even shorter life expectancies. So that's why we're here. We need to get ahead of this. We need to start earlier, and I think we all agree that the time couldn't be more ripe for dietary guidelines for pregnancy and young children from birth to 24 months. So to arrive at these nutrition recommendations, as has been mentioned by some of the previous discussions, we really need evidence-based information to inform that information and that process. And that's something that we're happy to have the ability to do at Nestle through our commitment and investment to the Feeding Infants and Toddlers study. This is the largest dietary intake survey specifically focused on infants, toddlers, and preschoolers under the age of 4. We started FIT 17 years ago, and we're proud to now say that we've surveyed nearly 10,000 parents and caregivers across 3 different surveys. And to say the least, we've learned a lot. We've learned about the foods young children are eating, we've learned about nutrition gaps that are forming during this critical developmental period, and we've also learned the importance of many of the nutrition assistance programs that have been talked about today, like the WIC program, like the SNAP program. So just a week ago, we were happy to have the opportunity to publish the latest data from FITS. And hopefully, if you haven't had the chance to see it, there are 9 new studies published in the Journal of Nutrition. This was done in collaboration with a number of medical and nutrition experts, and all of this research can be accessed on nestleusa.com. Also, hopefully when you entered the room, you saw that there were some fact sheets summarizing the key facts from the science at the front table. So I just wanted to take a minute to kind of talk about some of the key opportunities that's come out of this newest research. And many of these topic areas have been touched on in the previous conversations. So just to talk a bit about where we've made some progress and where there are still many opportunities to start early and improve. First is breastfeeding. There's been a lot of positive strides made. So we've seen, similar to the CDC report just a few weeks ago, that more parents are breastfeeding and they're sticking with it longer. However, we know there's still important topic that we can't stop here. We need to help continue to support moms in initiating and sticking with breastfeeding. Secondly, I would say arguably one of the most important findings that continues to come out of the FITS research is the fact that dietary patterns are established very early. We've been alluding to that in the conversations. The data speaks to this tremendously. In fact, when children during infancy start receiving complementary foods, those dietary patterns start to form. And by the age of 2, they're fairly set. Now, part of me says, okay, yikes, we really need to get it right early, but the other part of me says this is a fantastic window of opportunity to really help and support parents in building that foundation of lifelong healthy eating for their children. And third, there's a lack of not only healthy foods, so fruits, vegetables, dairy products, whole grains, but also the nutrients that come along with these foods that we see all the way in the start from infancy and toddlerhood. In fact, you may or may not be surprised to know that French fries are the #1 vegetable in this country by the age of 1. Oh, skipping forward. And talking about infants for a minute, another concerning finding is the fact that iron gap, so iron, an important nutrient for not only brain development but learning during this critical time period, has continued to rise. So we now have 20% of American infants between 6 and 12 months who are not getting enough iron in their diet. This gap has in fact more than doubled since we started collecting data in 2002 from FITS, so something we really are concerned about as a public health community. And then finally, I've talked a lot about foods, but we can't forget about beverages as well, and the opportunity to really improve the beverages that children are getting from an early age. We see between 1 and 4 years of age that 20% of children aren't drinking milk, and another third are already drinking sweetened beverages by their first birthday. But there's one issue here, and it's a fact that there's a disconnect. We see one thing in the data, and we hear another thing when we speak with parents in the study. And that's the fact that they think when it comes to their child's nutrition, things are going pretty well. In fact, you can see here on these data points that most parents report that their children are getting enough fruits and vegetables. And what I'm not showing you is they also report that their child's body weight is just about right. We know from the stats that this is quite contrary to the truth, and there's a lot of opportunity for education with parents of children with these young ages. But parents aren't to blame in this. We all know that everyone wants the best for their children, and in fact, I would say this is a great window of opportunity because they're actually hungry for nutrition information from the time starting in pregnancy through the child's first few years of life. So collectively, we need to help educate and empower parents to make healthy choices for their children from these early time periods. And at Nestle, we know that creating actionable change requires collaboration, that none of us can do this alone. It's about bringing all the sectors to the table in the community to really make impactful action. And I'm showing you a few examples here of ways that we've done that. So one is partnering with pediatricians and healthcare professionals, the ones who are really on the front lines addressing parents' questions during this early time period. We're proud that we're the founding sponsor of the American Academy of Pediatrics Institute for Healthy Childhood Weight. And we're also a national strategic partner with USDA's MyPlate, as Administrator Lips talked about earlier. And this is an important initiative to help disseminate key messages in an innovative way to consumers. And then finally, we also value the importance of impact in the local community. And we partner with key institutions such as the YMCA to help bring educations to families through the Start Healthy, Stay Healthy program. And this is one example where there's been an effective public-private partnership that has really been able to bring the FITS research that I talked to you about previously to life in the community. So real-world, actionable solutions to talk to parents about these important topics of starting salads or healthy snacking, for example. So in summary, I'd like to end with a few concluding points, as well as really underscoring my appreciation for all of your attention and participation today. First, it's the need to start early. As the research continues to demonstrate, these dietary patterns are really formed during this early critical time period, and we have an opportunity to make positive change. Second is the need to bridge the gaps. So we see both food as well as nutrient gaps occurring all the way from the start. We need to help educate and empower parents to make healthier choices. And that's the third, is parents need our help. So none of us can go at this nutrition journey alone. And together, with multi-sector collaboration, we know that we can really move the needle and make a difference in this space. Thank you, and last but not least, a big thank you to The Hill for all of your organization and for putting together a fantastic program today. Thank you.